Hi, I'm Suzan Haskins.
And I'm Dan Prescher.
As current residents of Ecuador, we can tell you from firsthand personal experience that one of the great benefits for foreign residents living here is high-quality, low-cost health care.
An internet comparison of healthcare costs from around the world found that Ecuador's costs are among the world's lowest, lower than in China, Malaysia, India, Mexico, and Panama. In general, you can expect to pay 10% to 25% of what you would in the U.S. Costs can be even less for dental care.
You know, Ecuador may be a developing country, but you'll find it offers first-rate medical care, particularly in the major cities. Many doctors are educated in the U.S., Europe, Argentina, Chile, Cuba, and they continue to train around the world.
In many ways, the medical care here reminds us of the U.S. in the 1950s and 60s. House calls are not uncommon, and in most cases, you won't be pre-screened by nurses or nurse practitioners. Instead, you'll get personal attention from the doctor. We've had doctors themselves take our basic information and medical histories. We've even had doctors give us their personal cell phone numbers for questions or emergencies. And when we called, they actually answered.
You know, in many cases, a visit to a general practitioner can cost as little as $25 to $35, while a visit to a specialist may be $30 to $40 and up. You'll pay more, of course, somewhere like Hospital Metropolitano in Quito, which is the only hospital in Ecuador thus far to be JCI or Joint Commission International certified. For follow-up visits, there's usually not any charge at all, and simple ambulatory procedures that are equally inexpensive. For example, a friend had a small lump removed under local anesthesia and a biopsy, and that cost about $125. Brand name medicines usually cost less than in the U.S. Generics, which are widely available, are also much cheaper.
You know, there are three health systems in Ecuador: the public system, the National Social Security System called IESS, and the private system. Most doctors with private practices also devote part of their time to the public or social security system as well.
The public system serves the needs of the poorest Ecuadorians, and it's absolutely free. But public medical facilities can be pretty bare bones, especially in the countryside. They often don't have even the most basic equipment that North Americans would expect in a small-town clinic. Few foreign residents use them for that reason, except for anything but vaccinations and emergency situations.
The IESS system is a step up in quality and is the main resource for Ecuadorians who contribute to the National Social Security System through their work.
But it's really private care where Ecuador shines. The quality is very good to excellent, especially in larger cities like we've said, and private care can cost as little as 1/5 the cost in the U.S. Of course, private insurance is also available and at a far less cost than in the U.S. Most companies require that you be less than 65 to apply, but once you obtain coverage, you can stay on the plan forever. Recently, there have been several companies that have started qualifying people up to age 70. Because of the low cost of healthcare in general, many expats in Ecuador don't even have health insurance. They simply pay out of pocket when they need medical attention. Your own financial situation and your tolerance for risk will help you determine if you decide to purchase a policy or not. But be aware that U.S. Medicare and many other foreign health insurance policies will not provide coverage in Ecuador or anywhere outside the U.S. and its protectorates for that matter.
Dental care in Ecuador is also a bargain, often costing 80 to 90% less than in the U.S. Dentists are well trained and have access to the latest technology. Many also speak English. Another advantage of working with Ecuadorian dentists is that they don't insist on taking multiple sets of x-rays, as is common in North America. A recent directive from the American Dental Association advises U.S. dentists that they should consider denying service to patients who refuse to allow x-rays to be taken. The opposite is true in Ecuador, where dentists understand that the patient has the right to help determine his or her own care and treatment.
Speaking of x-rays and other tests, in Ecuador, the patient owns his or her records, x-rays, lab results, and so on. You keep these at home and you bring them with you to appointments as needed. You pay for them, they belong to you.
Another nice thing about the Ecuadorian medical system is that on a per capita basis, Ecuadorians use alternative treatments much more than North Americans and Europeans. In fact, you'll find homeopathic and naturopathic practitioners in most large towns.
A major draw for many expats also is the fact that Ecuador's equivalent of the U.S. Food and Drug Administration is not a police force doing the bidding of the pharmaceutical industry here. The Ecuadorian Constitution guarantees the right to use the health care of your choosing.
All things considered, Ecuadorian healthcare is an incredible value, dollar for dollar, when compared to healthcare in the U.S. It's one of the reasons so many foreign residents are living happier and healthier lives in Ecuador.